dying, more people are getting it. We just keep them alive longer thanks to modern medicine. We can give them enough pills to keep the system going when it wants to fall apart and die. We can give them enough infusions and keep them on life support or whatever it may be, a long tenure of life support, but we just do it better. So they're getting heart disease more, we are now, than we've ever before. We just know how to keep people alive with it. That's not living. And in fact, if Ansel Keys, that first study, had looked at other countries outside the 22, if he had looked in, say, Europe, so there was something you might have heard of known as the French paradox, if you've ever heard that. That's referring to the fact that the French eat a lot of saturated fat and yet have very low heart disease. It's not a French paradox. You can see all they needed to really do was look at any of the countries in Western Europe who are eating loads of saturated fat, or more of the countries in Western Europe, and in fact there's a negative correlation. The countries that were eating more saturated fat were dying from less heart disease. So this was the French paradox, and my point being, it's not really a paradox. It's far more widespread than people wanted to believe at the time. And what about diabetes? That's my forte in particular. Look over the same span. If you look around 1970 along that bottom axis, we have increased 6 or 7 times to the point where diabetes or prediabetes is now, as I said, the most common disorder. And we'll come back to that again. So what happens then? If we look at the standard American diet in the middle, what happens if we shift the macros back and we start bringing up fat again? We start pushing down carbohydrates where they used to be before we were told to eat 6 servings of grain a day or whatever it may be, and then bring protein up a little bit. Interestingly, fat and protein in nature are designed to come together. In fact, let's do a fun little exercise. Can you guys think of essential fats in the diet? Are there such things as essential fatty acids? There are. There are fats that we have to eat for our body to be healthy. Can you think of, have you ever heard the term an essential amino acid? There are amino acids we have to eat. Can you think of an essential carbohydrate? There isn't one. So why are we eating so much of it? Now, there are these 3 key diseases I just want to touch on very briefly. Heart disease, the leading killer, dementia, specifically Alzheimer's disease, and then just body fat. I hate to call body fat a disease, so we'll just call that just a disorder of metabolic function. So if we shift our macros, again, this what I'm going to go over now is data supporting the idea that if we shift the macros to this scheme on the right, increasing our fat back to where it used to be, pushing down the carbohydrates and letting protein come up along with the fat that we eat, what happens? This study looked at 2 groups. The amber color is a lower carbohydrate group, and then the kind of faint bluish green is a low-fat group, the sort of now infamous low-fat diet that everyone embraces. Look at the changes in triglyceride, TG on the far left. The group eating a higher fat, lower carbohydrate diet had a 50% reduction in their triglycerides compared to the low-fat group eating very little fat. They had around a 15 to 20% drop. Their HDL cholesterol, if we go over to the next box, that went up about 15% in the group eating more fat and lower carbohydrate, and it didn't change at all. The triglyceride to HDL ratio had a much greater drop, which is a good thing. In fact, that's one of the best predictors of heart disease, far better than LDL number. ApoB, another marker, better with the lower carb, higher fat diet. And then small LDL. That's something that many people aren't familiar with. I've even talked to physicians who aren't familiar with that. The reason why the LDL total number isn't very predictive of heart disease is because it's not telling us the size, the diameter. Some blood tests can do this, and I encourage you to ask your doctor, tell me what my LDL diameter is. And the smaller it is, the more atherogenic it is. The bigger it is, the less atherogenic, the less likely it is to create plaques in your blood vessels. So small LDL is the bad one, and it drops more. They have a better drop, a greater reduction by eating more fat and controlling carbohydrate. This study followed people for 12 months and put them on either a low carbohydrate or a low fat diet. And they found that at 12 months, the lower carbohydrate group had a greater decrease in triglyceride level and a greater increase in HDL cholesterol, 2 very good outcomes. And the conclusion was that it was better for cardiovascular health. This was a very big study just recently published that sampled roughly 150,000, 135,000 people across 18 countries. We'll just look at this on the right. For decades, dietary guidelines, I won't read it to you, you can take a picture. Basically, the essence was the groups that were eating higher sugars and starches had greater incidence of heart disease, and dietary fat wasn't relevant at all. It's called the PURE study, P-U-R-E. I encourage you to look it up. Just published, made huge headlines because it was so massive in scope. Now what about dementia? Alzheimer's disease. My dear grandma, I'm leaving right after this back to go up to Lethbridge, Alberta for my grandma's funeral after that, but it was wonderful. She was ready to go. She just died from Alzheimer's disease, had it for 8 years. And it was miserable to see her. So one of the reasons I eat the way I eat and live the way I live is I don't want to go out like my dear grandma did. I want to be shot by a jealous husband or something. These are the little things we bald guys tell ourselves to feel better about ourselves. So Bob's joking about his haircut, and I'm sitting in the back thinking, it could be worse, Bob. Anyway, I found a girl who was just blind enough to think I'm handsome, so it works for us. So this study took a group of people, 6 patients that had early stage Alzheimer's disease. So they were beginning, some of them had to quit their jobs already, some of them were getting demoted or reducing their capacity at work, but all 6 of them had serious beginnings of Alzheimer's disease. And so this physician instituted a change. The change is outlined on this, which you can't really see very well. Along the top, it mentions optimizing diet, in particular, minimizing simple carbohydrates, things like simple starches and sugars. Basically, if it comes in a bag or a box with a barcode and sits on a shelf, don't eat it. That's going to be a simple carbohydrate. So they cut down the simple carbohydrate in order to control something called insulin resistance, which we'll talk about. They encouraged a degree of fasting every night to promote autophagy, the process whereby the cell begins clearing itself out, and increasing a process known as ketogenesis, to have the liver create ketones to feed the brain an alternative fuel other than glucose. The brain can use glucose, or sugar in the blood, or ketones. And then another one, keeping the fasting insulin right in the middle. Fasting insulin, keep it in control. And fasting insulin, I'm going to come back to. And at the very end, he mentioned he would give the people coconut oil, which is enriched. Coconut oil or goat dairy has more medium chain fats, which is a whole other topic, which is very fun to talk about, but not here. Now, so what happens to body fat, shifting from dementia? We'll come back to some of the outcomes of that dementia study. And with body mass, we see that on the lower carbohydrate, body percent went down. In fact, who cares about body mass? We know body fat. It went down 20% compared to around 12% on the low-fat diet. And insulin, which I'm going to talk about in a moment, and its relevance to all of these things, insulin came down about 50% on the group that was controlling carbohydrates, as opposed to around 15% on the low-fat diet. And again, we don't quite yet appreciate the relevance of insulin. I'll give you that in just a moment. Now, so what does this same study I showed you earlier, I'm just bringing back in and highlighting a different part of it, where there was significantly greater weight loss on the group that was controlling carbohydrates and more liberal with fat versus the low-fat group. And it's tempting to want to really go on a tangent and say, but fat, some of you are thinking, but fat has twice as many calories as carbohydrates do, and that's true, but there's more to body fat than just calories. You have to consider hormones. Anyone who's known someone in the room who had ever had to start to take anti-inflammatory medications to control an inflammatory condition, they gain a lot of weight. They might start eating the same thing. We'll talk about insulin's relevance and indeed its supreme relevance in just a moment. Anyway, more of the same. This study took 2 groups for 6 months, had one group eat a low-fat, calorie-restricted diet. They said to this one group, like everyone tells everyone, you can't eat more than a certain number of calories per day. You're stuck at that. The other group, they said, eat as much as you want, you just can't, you have to limit your carbohydrates. So they ate more, but they lost over twice the amount of weight. Double the weight loss, double the fat loss in particular. You'll see they lost almost 5 kilos of fat, pure fat, versus only 2 kilos in the low-fat group. And they were eating more calories. They didn't have to starve. They didn't have to push away the plate when they were still hungry because they said, I met my calorie quota for the day. No, they ate when they were hungry. They didn't eat when they weren't. They just watched their carbohydrates and over double the fat loss. So, All of these three conditions, too much body fat, heart disease, dementia, what they all have in common is this condition known as insulin resistance. And insulin resistance is, in all honesty, the most common health disorder in the world. Over half of all adults in the US, half of all adults in China, over half of all adults in India, which is mostly a vegetarian country. And you'd think, well, they should be the best. No, they're not. Same things in Canada. This is spreading around the world. Singapore, prediabetes, which is what insulin resistance is known as. This is the plague of prosperity. And this would give you more ammo when someone wants to wonder what good is shifting macronutrients. You're going to say it's going to control your insulin, or you can't. You can say whatever you want. You could say, if it were me, I'm on your shoulder saying it's controlling your insulin resistance. And once you do that, you start controlling these big three conditions. And mind you, many more. We just don't have time to go into it. So one of the key things, as insulin, look on the left side, as insulin is going up in a person's diet over time because of the foods they're eating, that is bringing down their insulin sensitivity. So they're becoming more and more insulin resistant as insulin is staying higher. What happens when a person starts drinking too much alcohol? Is that one same glass of wine enough to get a buzz? Over time? No, a month later they need two. Maybe, I actually don't drink, so maybe 6 months later, I don't know. But then on the right side, what we see happen is that if a person can bring their insulin down, sensitivity increases. And this is a phenomenon I mentioned on the bottom. Any organism will have this phenomenon. A constant stimulus will elicit a resistance to that stimulus, right? I remember running my first marathon. I've only ever run one. Bob's run multiple. I'm not crazy enough to run another one. But I remember I don't drink coffee. I'm very caffeine naive. Yet caffeine can be an ergogenic aid in a sporting event. I took my one caffeinated little pack of, carbohydrate and caffeine, and I was ready to go. My running buddy, for every one that I took, he had to take 3. That guy was a chronic coffee drinker. He just couldn't get enough caffeine. It didn't work in his body as well as it did in mine, because he had too much of that stimulus. Does that make sense?
Yes.
Yeah, good. So a constant stimulus leads to resistance to that stimulus. So we want to control insulin by bringing insulin down. And this is relevant. We come back to these same 3 macronutrients, fat, carbohydrate, protein, and look at what protein does. That small little blue bar. Protein at around 90 minutes, that little 15 at the end should be a 90. Around 90 minutes, we see that protein increases insulin by about double over fasting levels. Not too much. And mind you, that also depends on other things happening in the body. That can change. Carbohydrate can increase insulin over 10 times fasting levels. And then if you look at pure fat, you can't even see it because it doesn't change insulin. Insulin won't change when you eat fat. So what good is this? What does this do? What is insulin resistance? And so I want you to know insulin resistance on the top, that is when some cells fail to respond to the hormone insulin. Like, for example, one of insulin's actions is to drive glucose from the blood and push it into the muscle, out of the blood. If your glucose stays too high in your blood for too long, it can kill you through something called a non-ketotic coma. You're losing too much water in your urine and you start to go unconscious, or you just go unconscious. So some cells don't work the right way with regards to insulin anymore. And insulin affects every cell in our body, from top to bottom. And then lastly, the amount of insulin you have in our body is going up. That's a condition called hyperinsulinemia. Whenever you hear that suffix emia, that means in the blood. Too much insulin in the blood. Now, so what? How can we make this better? So this is just a general idea, a few studies. By all means, take a picture, look them up on your own if you'd like. These are studies just to show that as we shift macronutrients to favor fat and start to put carbohydrate in its place, we have generally very good improvements in just health, specifically diabetes in this case. And then with heart disease, this is just, there are tens of thousands of articles published in this realm of the connection between insulin resistance and heart disease. I'm just showing you a small little snippet of them. This is how insulin resistance is linked. I make my students memorize this. It's how it's linked to sustained hypertension. You know what hypertension is? That's when our blood pressure is too high. We always want to say, oh, it's because you eat too much salt. It's more because you eat too much sugar. And if insulin's up, hypertension's up. And as you control insulin, you control blood pressure, whether you're eating a lot of salt or not. Only some people are salt-sensitive hypertensives. You might have known someone where they say, try to control your salt, and they're perfect at it, and their blood pressure doesn't change. Or someone else is saying, I need to eat more salt to increase my blood pressure, and it doesn't work. Most people are not sensitive to salt in that regard, and if they are, it's usually because they're insulin resistant. That's salt-sensitive hypertension. Now with dementia, this study found a link between insulin resistance, and they found that for every 10 years a person has diabetes, which is insulin resistance, the brain looks 2 years older than those of similar age. So this type 2 diabetes, this insulin resistance, is aging the brain. In fact, that connection between Alzheimer's disease and diabetes is so strong that some people call Alzheimer's disease type 3 diabetes. I actually bristle at that because it's just the same as type 2. It's insulin resistance. It's just insulin resistance of the brain. The brain isn't responding well to insulin, and it's not using glucose very well. Now, what about body fat? This is an interesting little timeline of the relevance of insulin in body fat control, but I want to emphasize to you that the fact that insulin is the only hormone in the body that can tell a fat cell to get big. Insulin must be elevated for a fat cell to grow. In contrast, insulin must be low or basal, normal, in order for a fat cell to shrink. It cannot happen. I actually work with fat cells in dishes in the cell culture model. We'll use little fat cells. We can't even make them get fat unless we put insulin into that culture medium, we call it, into that culture liquid. They can't become fat cells without the insulin. So, this is a little freaky, isn't it? On the left, these are type 1 diabetics. On the left, we have a woman, that's her midsection, that's her upper thighs, her knees are below the image. On the right, we have, of course, that man's belly. These are type 1 diabetics. So what does a type 1 diabetic have to do?
Inject.
They have to inject insulin. Why do we tell them to rotate their injection sites? So that they don't have these fat pads, the fat parts of the body, grow that much. These are not tumors, it's just fat. So she has those awkward fat pads because she's been giving all of her injections in these two spots her whole life. He's been doing all of his injections right here. So I show this just to emphasize the fact that when you have a lot of insulin in one spot, it looks like that. When you have a lot of insulin in your whole body, well then it's just happening everywhere. This is the first patient in the US to be treated with type 1 diabetic to be treated with insulin, because of course insulin is a Canadian product. Look at her, in just 4 months, look at the difference. She was eating less and she'd started gaining fat to be a normal, healthy little girl. But we have to have insulin. Now this is type 1 diabetes. Let's look at a state of type 2 diabetes. When type 2 diabetics, when their glucose begins getting out of control, usually the physician will start giving them insulin, which I consider something akin to giving an alcoholic more alcohol to control their alcoholism. Wow. It's not the right way to do it. But be that as it may, the physician doing their best is thinking we need to control glucose, and if we have to bump their insulin up maybe even higher, well then so what? You're beginning to understand the so what. It matters. When you give a type 2 diabetic insulin, a lot happens. Well, I'll just talk about body fat. So look at month 0 to month 6. What's happening to the amount of insulin they have to give themselves? And why is that? Because too much insulin causes insulin resistance. Let's look at next what happens with body weight gains. They gained over this course about 9 kilos of body weight in just 6 months. All of it fat. That's common. The average type 2 diabetic, when they begin insulin therapy, they'll gain around 15 to 25 pounds of pure fat. Now, you'd think, well, they must be eating a lot. But what's happening to the amount of calories they're eating per day? It's about 300 fewer calories per day at 6 months than it was at 0 months. You can't explain that fat gain, almost 10 kilos of fat gain, because they're eating more. They're not. They're trying to control their weight gain, but the insulin is what's driving the fat cells to continue to grow. So what can you do to kind of speed things up as I wrap up? 3 pillars. Be smart about the starches you eat. 2, don't be afraid of fat. We are culturally afraid of fat. And then hurry and fast. Now what do I mean by any of these? I mean scrutinize the quality of the carbohydrate you're eating. And know that, for example, broccoli is not going to have the same effect on your blood glucose levels as bread or potatoes. In essence, usually if it's a vegetable, if it grows above the ground, it's going to be a good vegetable. The least of the starchy vegetables. And mind you, there's a lot to talk about with regards to even the composition and quality of fruits and vegetables now compared to how they used to be. Of course, we've bred them to be very different things, but in the end, you just want to know what's the effect on the insulin. And this is a very simplistic way of breaking that down. Don't fear the fat. Basically, if it is from a fruit or animal, it's okay. That's on the left. Those are good fats. As a species, we've been eating them for millennia or millions of years. And then on the right, these modern oils that have come with my parents, within our lifetime here collectively. These are the soybean oils. We call them vegetable oils, but they're not actually from vegetables, or corn oil. But soybean oil, canola oil, these are oils that are much, much newer. We're poorly adapted to them, and many of them have been so heavily processed with chemicals that we have remnants of those things. As opposed to getting oil from coconuts, you just press the coconut. Getting an oil or a fat from the animal, it's just in the meat, with the protein as nature intended it. Now lastly, hurry and fast. What I mean by that is, the average person who would eat 3 meals a day, their insulin levels will look something like this, where most of their waking moment is spent in a state of elevated insulin. You can see the problem. You now are appreciating what that's doing to their body. The benefit of having a time-restricted feeding, whether you want to call it fasting or just compressing your meals in a day, and you wouldn't necessarily do this every day, but look all of a sudden, by eating a smaller breakfast, or at least, dinner in this case, or whatever you would want, but usually it's going to be breakfast or dinner, by either not having it and just drinking something instead, or controlling the carbohydrates and being more liberal in fat, you're controlling your insulin a little better. Then you have that greater period of time in a 24-hour period where you can be catabolic at your fat cells. You can be breaking down fats rather than storing the fat. Because if insulin is up, you're not breaking the fat down. The fat cells are going to get what they want and get big. So these were the 3 pillars. Again, be starch smart. I'm not saying never eat carbohydrate again, but be smart about it. Don't be afraid of fat. My personal mantra is I look at a meal and say, is there enough fat to 1, fuel my body? I'm an active person. I want energy. And 2, is it going to help keep my insulin in control but feed the rest of me? I don't want to feed my fat. I just turned 40 a couple weeks ago. And I'm bald. I don't have a lot of wiggle room here. I gotta keep my wife interested. Anyway, and then hurry and fast. Find a time that works to compress your meals. And that will help control insulin. It's not that you're eating less. You still eat till you're full. But as you shift your macronutrients and your body begins to run better on using fat for fuel, you find that suddenly missing a meal is really easy to do. But when you're carbohydrate dependent, it's not so easy.